Well, hello and good morning and happy Sunday and happy to welcome to another Sunday Coffee with Dr. Childress here. Today I'm going to be discussing the spousal abuse in the family courts using the child as a weapon. So this is the spousal, emotional, and psychological abuse of the targeted parent by the allied parent who's using the child and the child's induced pathology as the weapon of spousal abuse. And with this particular pathology in the family courts, it is at its core a brutal and savage form of psychological child or psychological spousal abuse of the targeted parent by the allied parent who's using the child and the child's induced symptoms as the weapons of spousal abuse. And that's a DSM-5 diagnosis of V995.82 spouse or partner abuse psychological. And so the spousal abuse, the retaliation and revenge for the divorce using the child, is actually the driving motivation for the allied parent, the ex spouse. But in pathologizing the child, they create such significant pathology, it becomes child abuse. Um, and so, yeah, and weaponizing the child as an instrument of the spousal abuse against the other parent, the allied parent creates such severe pathology in the child that it rises to the level of child psychological abuse, which is a DSM 5 diagnosis of V995.51 child psychological abuse. And the DSM 5 diagnosis, just the full diagnosis for the pathology in the family courts, is a delusional thought disorder, a shared or induced persecutory delusion, DSM 5 297.1, as well as a DSM-5 diagnosis of 300.19 factitious disorder imposed on another. It's a false or a factitious attachment pathology being imposed on the child for secondary gain to the parent. So people who are saying this pathology isn't in the DSM-5, of course it is. They are just having a look. They're just lazy. It's absolutely in the DSM-5. It's a shared delusion and factitious disorder. And either one of both of those will wind up on the child psychological abuse diagnosis. And that's a V code. Those are not primary diagnosis, those are modifying diagnosis, the V codes. So the child psychological abuse is not a psychiatric disorder in the child, it's something that's happening to the child that's modifying the primary diagnoses. And then there's also a second V code of spouse or partner abuse psychological for the targeted parent by the allied parent using the child as a weapon. And so we actually, in the family courts, have two different dangerous pathologies. And let me explain a little bit about dangerous pathologies in professional psychology. There's three of them, and that's a category of pathology. There's three. There's suicide, homicide, and abuse, child abuse, spousal abuse, and elder abuse. And whenever a mental health professional encounters any of these dangerous pathologies, suicide, homicide, or abuse, duty to protect obligations are active, and the mental health professional is required to take one of two steps. Either they personally have to conduct a risk assessment for the danger involved, such as a suicide assessment if the person says they're suicidal or something, or they have to ensure that a proper risk assessment for the danger is conducted, such as if they're not going to do the risk assessment for suicide, then they refer to the emergency room and have the ER refer for suicide. So that's a category of pathology, dangerous pathology. It activates professional duty to protect obligations. And then the professionals have to take what's called affirmative action and chart that affirmative action in the patient's medical record. So we have a pathology, two dangerous pathologies in the family courts, and that would activate duty to protect obligations. The first one is a duty to protect, or the overall obligation is a duty to protect from the two dangerous pathologies. And Wikipedia defines the duty to protect. Professional psychologists, clinical psychologists, all doctors have two legally obligating duties. Let me pull this up for a second. All doctors have two legally obligating duties: duty of care and duty to protect. Duty of care means you're now my patient and I have to have certain responsibilities to you to make sure I'm competent, to make sure I don't abandon you and that you have proper care. So that's duty of care obligations. We also have duty to protect obligations, and that's for suicide, homicide, or abuse, child abuse, spousal abuse, or elder abuse. It's for not only our clients, but for larger general society as well. We have obligations to protect people. And this is the description of that from Wikipedia. So, in medical law and medical ethics, the duty to protect is the responsibility of a mental health professional to protect patients and others from foreseeable harm. And so, we have a duty to protect in the family courts for both of those dangerous pathologies, both the child psychological abuse and the spousal abuse of the targeted parent by the allied parent using the child as a weapon. And so that's what I want to make clear to all parents and to all mental health professionals out there. We, the mental health people, have two duty to protect obligations, not only for the child psychological abuse, we also have an obligation to protect the targeted parent from the spousal abuse using the child as a weapon. Okay. So those are legally obligating duties that are active with all court-involved pathology, because the only thing that causes the attachment pathology is child abuse by one parent or the other. So it's either the targeted parent being abusive, in which case we have an abuse diagnosis there and duty to protect obligations, or it's a factitious attachment pathology, and we have child psychological abuse by the allied parent, and we have duty to protect obligations there. In addition to the spousal abuse duty to protect obligations relative to use the other parent using the child as a weapon. So we have two duty to protect obligations. And the to recognize just how extremely savage and brutal this spousal abuse is. The targeted parent used to have a child before the divorce. They were a parent, had a child, were doing parenting things. However, after the divorce, that parent no longer has a child. Where'd that child go? They're no longer parent to a child. The allied parent has psychologically killed the child of the other spouse and parent in revenge and retaliation for the failed marriage and divorce. That is a brutal and savage emotional and psychological spousal abuse of the targeted parent using the child and the child's induced pathology as the weapon of spousal abuse. So, to be clear, this is this is far more brutal and savage a form of spousal abuse than getting beat with fists. Getting beat, you just cover up. This is continual and it's emotional and it's to your soul. It's to you, to everything about you is getting brutalized by the child, by the child's pathology, by the court system, by the finances, by everything about this pathology. This is such a brutal spousal abuse. And none of the professional mental health professionals are responding to the spousal abuse component of the pathology. They're not even responding to the child abuse component. They are just failing entirely on their duty to protect obligations. And there needs to be consequences. There needs to be accountability for the mental health people for failing to protect the children, failing to protect the parents in the family courts. It's just an abomination what's happening over here. Because this is really important to understand about this particular pathology. If the mental health professional and or the court believes the shared delusion as if it was true, then the mental health professional and or the court become part of the shared delusion. They become part of the pathology. And when that pathology is the psychological abuse of the child by the allied parent, then the mental health professional and the court become part of the child abuse. And let me emphasize that because that is so important. If the mental health people misdiagnose the court, or if the court doesn't get an accurate diagnosis from the mental health people, and so the court misdiagnoses the persecutory delusion, then and believes it as if it's true and responds to it as if it's true, then the mental health professional and the court become part of the pathology. They become part of the pathology. And when the pathology is psychological abuse of the child, that means the mental health professional and the court are participating in the psychological abuse of the child. They're child abusers because of their misdiagnosis. And then we get into why did they misdiagnose it? Practicing beyond the boundaries of competence. So, in addition, and this is so critical to understand, and I think there's lawsuits for parents out there on this issue. When the pathology is also the psychological spousal abuse of the targeted parent by the allied parent using the child as a weapon, then the mental health professional and or the court become part of the spousal abuse of the targeted parent. So the mental health professional, because they are practicing beyond the boundaries of their competence in violation of ethical standards, misdiagnosed the shared persecutory delusion and believed it was true. And so they participated in the removing the child and the pathology that is removing the child from the care of a normal range targeted parent. And they are participating in that, doing that. They are participating in the brutal and savage emotional and psychological abuse of that parent by taking their child away, by preventing them from being with their child for no reason, and actually for the opposite reason. They are failing to protect the child from the abusive parent, and they are spousally abusing the targeted parent. That mental health professional needs to lose their license for just their lazy, incompetent practice that wound up being a spousal abuser and child abuser. And given all the immense psychological trauma and suffering to these targeted parents for years because of the incompetent mental health people participating in their spousal abuse, absolutely they need accountability and need to lose their license. We don't need child abusers and spousal abusers as the mental health professionals in the family courts. You know how bad that is? When the mental health people are the spousal abusers and the child abusers, and they're participating in all of that, there needs to be a clean sweep. All the forensic psychologists, New York Blue Ribbon Commission, get rid of all the forensic psychologists and get quality mental health back people into the family courts who are going to protect children and protect their parents from abuse by a pathological, narcissistic, borderline dark personality parent. So with that, there I am. And so you know where to find me. I'm doing what I can do relative to holding the mental health professionals accountable. But as long as there's no motivation in the professionals to be competent, as long as there is no accountability for being unethical, incompetent, malpractice, misdiagnosing child abuse, participating in the child abuse, participating in the spousal abuse, and zero consequences for any of that in the family courts, then you're going to get the lowest and just abusive level of mental health people, incompetent, ignorant, just awful. Patients should never have to explain the pathology to the doctor. But you guys are having to explain the pathology to the doctors because that's how bad and ignorant and lazy, just absolutely lazy, the mental health professionals are in the family courts. So they are failing to protect the child. They're failing to protect their parents from spousal abuse. 2, duty of obligation, and failing on both of them. And so with that, I really apologize to the parents out there for the low quality of mental health services you're receiving. I know it's like really tough on you, the spousal abuse component, and that's in terms of my practice, I'm looking to like maybe work with some coaches or something, because we can't expect the parent, the person who's being abused, to come up with their own plan for escaping the abuse. Where's the mental health professionals? Nowhere to be seen. So we're asking the abuse victim to come up with their own plan during the abuse, all by themselves, to fix it and to escape it and get the mental health people to be competent. So that's where I think a coach model of getting support in and then getting the professionals to give you the diagnosis is an appropriate model for the family courts. So with that, I'm going to head off to my Sunday here, and we'll talk to you about another aspect of this pathology next week. And Sunday coffee. Take care, everybody.